the main stuff is here. So, beta blockers, we talked already about it a little bit. What does it do? It blocks the adrenaline that increases heart rate. Remember, I gave you the scenario. Y'all a little upset over the exam. I'm walking across the parking lot. My adrenaline pumps up. My heart rate goes up because I see you're just coming at me, and I gotta run, get the more muscle, more oxygen to my legs. So, boom, heart rate goes up. But now I'm in my car, and I'm saying, Jesus, Josiah, does he really mean to do that to me? I'm so offended. I feel bad. My heart is pumping, but it's slowing down now. The parasympathetic, which is not on here, now is putting on the brakes. Okay? Adrenaline, fight or flight, and we need to control that with beta blockers. Here are some of the reasons: hypertension initially, angina, heart failure. Now, let me say something because I didn't say it earlier. CHF, we talked about CHF, congestive heart failure. That is a particular name. But in overall, the umbrella word is going to be heart failure, which is going to umbrella over CHF and cardiac, next myocardial. Yeah. So let's just know that if you see heart failure HF, it will encompass CHF, but other diagnoses in there. The next common thing that I would say are going to be ACE inhibitors. So again, I always will use myself. I'm very transparent. I'm not ashamed of anything. So remember, I try to eat right. We'll get to my eating part later. But I've been initially put on blood pressure medication, which are called ARBs. So ARBs basically is try to control the angiotensin II receptor blocker. It's a blocker. And those are ARBs. This is 2, angiotensin 2, bad. We need to calm this down. So what this is doing for me is relaxing those blood vessels. And so they have a little bit more flexibility, so the pressure is not so high. It kind of gives, calms down. This is one of the first go-tos. Then it's the ACE inhibitors. A little bit more aggressive, which is going to work a little differently with different steps, but it's still the same objective. It's going to cut down that angiotensin 2. So what is this called? ACE inhibitors. Angiotensin, A, converting, C, enzyme, E, ACE inhibitors. It's supposed to inhibit, block this from happening. Blood pressure, hypertension, CHF. So you saw that on that slide, remember? Because that CHF was given diuretics. Street name called water pill. So all that, remember, we talked water, got to get rid of it, got to go pee it out, diuretics. I didn't put it here, but I already pointed out which specific medications you need to know, right? Okay. So ACE, diuretics, and then calcium blockers are another one. So calcium blockers are muscles. In middle school you learned, I'm just assuming, probably not, that you learned in muscles work with calcium and potassium exchange. They have negative and positive polarization. So my muscle is out of control. My heart muscle needs to be calmed down. So let's calm down some of those components, calcium. And so let's block the calcium. You will see that. We're not going to be writing the full word a lot of times, so you're going to be Ca plus blocker, okay? It's going to relax the myocardium, and it also will relax some of the smooth muscles out in the coronary artery. So it's kind of a double powerful drug there too, okay? What's the next thing? As far as acute care, let's go backwards down here. We talked about nitroglycerin already. So the nitric oxide And then the sole purpose is to immediately, not tomorrow, but immediately within a few minutes, relax the blood vessels because of that, what? Angina. Little chest pain there, okay. So that's common. Now in an acute care, you might see digoxin. That is highly related with heart failure. So the heart is failing. It's lost its pumping mechanism. Remember that ventricular, it's just not helping. And remember, we're flatlining. We're going into that flatlining. So we need some assist. We need some help. They'll give that drug to increase the strength and the efficiency of those ventricles. Okay, it just needs a little boost, a little help. So it's going to help manage the heart rate and the rhythm, and usually found in an acute care environment. Okay, and then the last thing is just knowing the difference, but very similar effects, is antiplatelet and anticoagulant. Antiplatelet, specifically, we're managing the platelets, the stickiness of the platelets to block and to clot up that bleeding area. Okay, so Plavix, aspirin's questionable. It's still thrown under the category of platelets, but these are known to affect the platelets. Okay, versus anticoagulant prevents clot formation. So remember the whole process. You're cut, you're bleeding, so you need to patch that up. Yes, the platelets are involved, but remember there's much more difficult, complex processes. It's got to go in there, put in some fibrin, patch it up, let it sit, harden, and now you've got your blocked up artery. So anticoagulant and Coumadin, heparin, those are all going to fall under here. I think they're in this next slides that we'll go over. Okay, but but these two serve the same purposes. They're just used differently for different situations. Okay, but these are the categories I want you to start being familiar with. I said earlier, you'll probably get a couple of questions on this next exam, but I can guarantee you you're going to get less than a handful of questions on the final exam. So if you think about it, you've learned about pain medication and the different types, some heavy drugs and some over-the-counter drugs, Tylenol, all that, and then some narcotics, heavy drugs. So imagine patients on narcotics, oxycodone, or and then there are on digoxin. They're also on a diuretic. They may also be on ACE inhibitors. They're going to be on a lot of medications. My question to you, or your homework for the weekend, is what could go bad? What are the side effects?
Mm-hmm.
And what are those side effects? What does that have to do with your job? So think about that.
Wow.
And you can even answer it after class.
Yeah, I think there's a page in Score Builders about that.
Yes.
Oh, okay.